नमस्कार दोस्तों, एफआईआई के वीकली प्रोग्राम टॉक विद एन एक्सपर्ट के इस एपिसोड में आप सबका स्वागत है। दोस्तों, हर हफ्ते हम आपके समक्ष किसी न किसी इंडस्ट्री एक्सपर्ट को लेकर आते हैं और इसके पीछे हम सबका एक ही मोटिव होता है कि हम आप लोगों को गाइड करें या आपकी प्रॉब्लम्स का सॉल्यूशन दें। हमारा पर्पस सिर्फ बिजनेस के सॉल्यूशन देना ही नहीं, बल्कि आपकी प्रॉब्लम्स, हर प्रॉब्लम का सॉल्यूशन देना है। लेकिन हेल्थ जो है वो हम मेंटेन नहीं कर पाते हैं, चाहे वो वक्त की बात कह लें कि समय नहीं होता या प्रॉपर गाइडेंस नहीं होती। समय को तो दोस्तों हमें खुद को मैनेज करना है, क्योंकि भगवान ने हम सबको 24 घंटे दिए हैं, लेकिन गाइडेंस हम आपको प्रोवाइड कर सकते हैं जिससे आपका ये रास्ता आसान कर सके हम। तो आज हमारे बीच डॉक्टर माधवी जी हैं। सबसे पहले मैं आपका स्वागत करता हूं डॉक्टर माधवी जी। एंड
थैंक यू सर।
प्रोग्राम की शुरुआत करने से पहले मैं डॉक्टर द्रव्या से रिक्वेस्ट करूंगा कि वो इंट्रोडक्शन के साथ शुरुआत करें।
नमस्कार, गुड इवनिंग एवरीबॉडी। आज की प्रोग्राम की शुरुआत करने से पहले मैं फेडरेशन ऑफ इंडियन इंडस्ट्री के बारे में थोड़ी इंट्रोडक्शन देना चाहूंगी। Federation of Indian Industry is a not-for-profit organization. It is an advisory interface between the government and industries. We offer a platform for networking and relationship building within and across the industrial sectors, policymakers, and the international business fraternity. Our Director General, Shri Deepak Jain, he's an entrepreneur, philanthropist, thinker, writer, and an economic policies advisor. He's also the National Working President of Digambar Jain Mahasamiti. Our guest speaker for today, Dr. Madhavi Barai, is a dental surgeon, cosmetic dentist, forensic odontologist, and oral implantologist, and has been practicing for more than 10 years. She's also the founder of Avadhesh Dental Studio. She's also a public health speaker and has done extensive public health work, especially in spreading awareness of dental health for all age groups of women. I welcome you, Dr. Barai, today. Thank you so much for joining us.
Thank you, Dravya.
So Dr. Barai, I've given you a formal introduction, but we at FII, we want for our audience to know how you got motivated to become a doctor in the first place, about your struggles during medical school and your entrepreneurial journey, and a lot about your passion also. That is, I think, reflects through the work that you've done so far.
Thank you, Dravya. It all began because there was this feeling of bringing a change in the society that I had since the early years of my school. And that's when my mom, it's a very funny incident that my mom was getting her dental treatment done. And after my tuitions, I would go with her to see what is happening. And little did I know anything about it. Like, mujhe kuch pata hi nahi tha. Every time the dentist said that you have to do flossing, and I was like, what have I done so far? Like, all my life. He was explaining this to my mother, and my mother herself didn't know about it. So that was the time I realized that I want to become a dentist. And I started researching on it, learning about it. Coming to medical school was a different task altogether. There are so many hurdles when you are in a medical school. The learning hours, the teaching hours, they are so weird. But this was my passion. And I had realized it very early in life that being a dentist is all I wanted to be. During my college years, by around third or fourth year, we used to have a lot of NSS camps and public health speaking camps. And that's when I also realized that public health awareness is what I actually want to do through this. Being a dentist and making sure that the awareness is constantly spread, right? No matter what the journey is, the hurdles are always ready for you. But what is important is that you keep your focus on what you want to be. The college years are so tough that one might drop off easily, but to clear it is a task. And yeah, after that was done, the journey never stopped. I have kept learning. I completed my cosmetic dentistry. I did a lot of courses on it, hands-on courses, fellowships. Post that, I then built my interest in forensic odontology. I did that. I did a fellowship on forensic odontology. Implant dentistry, I did one fellowship on that. So this then stuck to me that every year I would learn something new. Today I speak like 5 to 7 languages. I know them because I've learned every language. I have stayed in a certain area and I have made sure that I learn the local language. When I was in Maharashtra, in Pune, I learned Marathi. Because I'm a Gujarati, I know Gujarati. But when I was in Muscat, I learned Arabic. Today I'm learning French. I'm still taking French classes. And that's because I like learning languages, but that's my personal interest. When it comes to dentistry, it is my passion. Spreading awareness is something that literally gives me the good feeling. Toothpick is a dental awareness magazine that I have recently launched under my proprietorship. Right? When I introduced toothpick to the society, the main aim was to create dental awareness. Why is it bilingual? So that I can reach the regional people as well as I reach the people who do not know the regional language but can read it in English. Yeah, at the end of every appointment, every patient is educated well on oral hygiene, on oral health, and how to maintain a basic routine with the dentist. So every patient that has walked in my operatory knows that he has to visit me every 6 months, even though if it's for 5 minutes, a dental checkup is important, is mandatory.
FIR in the past and today as well has celebrated women who are empowered and who are working towards
Correct.
working for empowerment of other women. So we applaud your effort. And
Thank you
again,
so
we
much.
welcome you on our show, and we're so honored to have you here.
Thank you, Dravya. Thank you.
And with this, I would like to start with the question answers. There are some questions that we have from our viewers, and we would like to know more about um, what is oral health and उसका जब हम oral health की बात करते हैं उसका मतलब क्या है? What all things one should know about um, as an adult?
So, when we say oral health, we should very well know this, or most of us would have heard it also, that oral health is the mirror to your overall health. Okay, now अब आईने में जो देखते हो, अगर आप उसको पहचान पाओ, तो you will know what the disease is or what the illness is. Right? When we say illness, it is something that is wrong or something that's going wrong in your body. Right? So if you have bleeding gums, a lot of people think that bleeding gums तो बहुत natural है, बहुत normal है, because my brush is too bad or it's been happening since a lot of years. I don't need to pay attention to it. But bleeding gums is a sign. It is a sign to something that is not right systemically in your body. That could be n number of things. Let's say diabetes, if it's a female, hormonal problems, or it could be a lot of things that indicate it, right? So you have to catch these indications. You have to know the signs. And to know the signs, you have to know what normal oral health is. That normal gums do not bleed. But if your gums are bleeding, it's not a healthy sign. So to know what is unhealthy, you have to know what is healthy, right? So oral health is all about what your overall health is. And now, when we say what oral health is, it is having the healthy ratio of pink and white, having healthy gums at the same time having healthy teeth. आपका any structure in the oral cavity, say the tongue, the gums, the teeth, the tonsils, the ulcers, everything indicates to some overall health problem.
Thank you, Dr. Madhavi. Now, what things one should know about oral health during pregnancy?
Right. So, oral health during pregnancy is very important and is the least paid attention to because we do not blame the mother to be. She is going through so much at that point of time. But the advice that a dentist would give is that to get a dental checkup done before conceiving, before getting pregnant. So, even if you haven't gotten the chance to come to the dentist before getting pregnant, you can do it during your pregnancy. And there is a huge myth attached to this कि प्रेगनेंसी के टाइम पे आप ओरल चेकअप नहीं करवा सकते या डेंटिस्ट के पास नहीं जा सकते so that is wrong. That is where the part of awareness comes again, that one should be aware that they can go to the dentist when required, even when they are pregnant. Having said that, there are safe periods, and even though there are safe periods, treatment can be done at any point of time. So basically, my advice is that before, during, or after pregnancy, oral health care has to be paid attention to. One major reason being that oral health, if your oral health is bad, like if the mother's oral health is bad, the bacteria travels through the bloodstream and reaches to the baby. This is lesser known fact, and this actually causes a lot of problems like low birth weight, preterm delivery, or even oral hygiene of the baby which is yet to be born. And the main reason being that the bacteria can travel through the bloodstream and reach to the baby. Right? Five good tips that I really want to give out to the pregnant ladies or the women who are now planning to conceive is get your dental checkup done before you get pregnant, and even if you're pregnant, get it done now. राइट इलेक्टिव ट्रीटमेंट जो होती है, जैसे कि अगर प्रेगनेंसी के टाइम पे दर्द हो रहा है या फिर प्रेगनेंसी के पहले ही काफी इश्यूज है जिसको आप रजिस्टर नहीं कर पाए हो बट अब कर लो, बिकॉज ऑफ द हार्मोनल चेंजेस इट इज गोइंग टू इंक्रीज, वो कम नहीं होने वाली है. राइट. Three, make sure you're using a good oral hygiene practice. You're into a good oral hygiene practice, like brush twice daily, use a fluoridated toothpaste, use non-alcoholic mouthwash, eat healthy. Right? अब COVID की वजह से तो we all have started eating healthy, so that goes unsaid. But yeah, these are the few tips I really want to give out there. Ki first of all, go to the dentist, even if you're not pregnant, and even if you are in the at midst of it, like in the middle of it.
ऐसे ट्रीटमेंट्स भी हैं या मेडिकेशंस ऐसी होती हैं which are contraindicated during pregnancy that one should know about?
Yeah, correct. So usually there are no medicines that we would give to a pregnant lady. One thing that they usually come to us is bleeding gums, because when the hormones are fluctuating, the gums, they start to bleed more often. One reason being that they haven't got their oral prophylaxis done before pregnancy about the medication, right? So usually a pregnant lady will come to us with bleeding gums. Now bleeding gums happen because they haven't got their cleaning done before pregnancy. Now once the cleaning is not done before pregnancy, तो ड्यूरिंग प्रेगनेंसी क्या होता है कि हार्मोनल फ्लक्चुएशन की वजह से गम्स बहुत ज्यादा ब्लीड होने लगते हैं, कुछ भी खाने की वजह से होने लगते हैं, ब्रशिंग करने के टाइम पे होने लगते हैं. So this is one thing that most of the pregnant ladies come to us for. Now in this there is no medication required. The only thing that is required, yeah, it is normal. Bleeding gums during pregnancy is normal, and the treatment is effective. You get a dental treatment done, it is effective, bleeding gums will stop. Right? Another thing they come to us is for dental pain. This could be because the wisdom tooth is erupting while you're having your pregnant term. And at this point of time, we safely give them paracetamol because it's safe to use only when they have pain. We teach them how to maintain good oral hygiene, and that's how we teach them how to clean from the back of the tooth, as in the last tooth, and that helps. Again, it is effective. The only place where we feel a little handicapped is when we have to introduce antibiotics. So we always consult their gynecologist. We tell them what the problem is here, and we locally clean it. We locally place antibiotics through the teeth, but we do not administer them. So that again effectively works.
And what would be the safe periods during pregnancy to visit a dentist or to get any dental treatment done?
Correct. So that's a good question. Second trimester is the safest. Correct. But having said that, it is safe to go to the dentist even if you're 9 months pregnant, because you do not want to live with the pain in your mouth while having a term. Right. So any time is safe, but what a dentist has to take care of here, that is important. Like when the patient comes to you, you have to make sure that the chair position is upright. The dentist has to make sure that x-rays are not taken if not needed. And these are the certain things that a dentist should take care of. But from the patient's point of view, as in from the pregnant lady's point of view, she can visit the dentist whenever she wants to. What treatment has to be done, that the dentist will take care of, and how it has to be done? How aggressively, I mean.
So we've talked about women during pregnancy. I think it's time we should talk about infants.
Infants.
जब इन्फेंट होता है, दांत नहीं होते, जब दांत आने शुरू होते हैं से लेके बच्चा जब 10 साल का होता है, 20 साल का होता
Correct.
है.
So,
उनकी oral
Dravya, what is the problem here is, I mean, the problem to everything is just one thing, and that is dental awareness. Now, the parents are not aware that a baby, an infant, a newborn needs dental cleaning, as in you have to clean the baby's mouth, right? So our parents, I don't know if they were aware, or even the now parents, if they are aware that a newborn needs you need to clean the baby's mouth. After every feed, the cleaning has to be done. Before the first tooth erupts, the cleaning has to start. It has to become a routine. So infants में ना cleaning बहुत compromised है. 0 to 2 years तक the parents do not pay attention because one, they are not aware, so we don't blame them. They don't know कि cleaning करना भी होता है. Right. So there are different methods. Again, if you also, I would like to mention it here that visit a dentist with your baby when the first tooth erupts in the oral cavity. Okay. So when the first tooth erupts in the oral cavity, that is the right time to visit the dentist. The dentist will know whether there are any future problems. Prediction can be done because a lot of kids are prone to baby bottle caries.
तो जब इन्फेंट होता है उसके मुंह में दांत नहीं होते, how is a mother supposed to clean?
Yeah. So one step is they can use a cotton cloth, wrap it around the index finger, dip that in lukewarm water or tap water is also fine, and lay the baby on the lap and just clean the mouth using their index finger, which is very easy for a mother to do, right? This should be done after every feed and after the baby has burped after every feed. So either after every feed or after the baby has burped after the feed, right? During this cleaning process, a lot of mothers complain that the tongue is too short, the tongue is not moving. They can see white dots on the gums of the baby. So these are called enamel pearls. और बहुत एक बड़ा मिथ इस पे भी है कि बच्चा दांत के साथ पैदा हुआ है तो डेविल है, राक्षस है. It's very wrong. So that can be taken care of and that can be easily done.
5 tips that you would like to give, to that a mother, that parents should take care of when the child
For
is
their infants.
below 10 years. Yeah.
Below 10 years. Okay. Number one, that visit the dentist either when the first tooth erupts or at the first birthday. Like gift your child a dental visit on the first birthday is what I tell to every parent. Right? Second, it's never too late to visit the dentist. So even if you have not up till now, visit a dentist now because a lot of things can be prevented. And prevention is always better than cure. So a lot of things can be prevented. Decay can be prevented. A lot of malpositioning can be prevented. All of that, right? Number 3, if your child has any such habits like sucking of the thumb, sucking of pencils, pens, any other parafunctional as in habits that are not normal. So don't normalize them saying ki, but my neighbor's kid is also sucking on thumb, so my baby is also sucking on thumb, and it's normal. It's not normal, and it has to be paid attention to. It has to stop at a certain age, and there are ways to do that, right? Number 4, follow oral hygiene. If you are not aware of it, I mean, if the parent is not aware of it, consult the dentist or consult. By the time the child is 10 years, there is mixed dentition. There are 2 set of teeth already जो दिखते हैं, milk teeth and the permanent teeth. So the permanent teeth should not spoil. That has to be the attention that needs there. तो permanent teeth को safe रखने के लिए क्या कर सकते हैं? That has to be taken care of.
Could you also please tell us a few points that a woman going through menopause, or adults in general going through midlife period or proceeding towards old age should know about?
Okay. So when we talk about menopause, again, like we talked about pregnancy, there are a lot of hormonal fluctuations. Even in menopause, that's the same scenario. When there are hormonal fluctuations, again, it is reflected in the oral cavity because something is going on in your oral health, it is reflected there. Now that reflection comes in as poor oral, if at all adding up to the poor oral hygiene, लूज टीथ इन्फ्लेम आई मीन जो गम्स होते हैं वो बहुत ज्यादा खराब होते हैं उस टाइम तक. Nobody has paid attention to the oral health so far. So now everything is seen on a wider scale. Suddenly everything starts to get inflamed, get swollen. The woman starts to feel ki at the time I'm having my menopause, why is my oral health also declining? That is just because for so long you haven't been taking care of it in the right way, plus not visiting a dentist at the right time, right? So for all these that have reached that age, I would like to tell them that it is not too late. Still, you can visit a dentist and make sure whatever is there, we can preserve it, right? And again, we can start a good oral hygiene routine, and make sure that whatever is there, preserve it. At the same time, what we are losing, how to regain it. So most females or males complain of losing teeth, of loose teeth, or pain. Of course, that's always there. Swelling, bad breath. So everything can be taken care of. But like I said, because there are hormonal changes, it reflects in the oral cavity. And this is one topic that I take when I talk about oral hygiene for women, because menopause is a big phase that they go through and a very irritating phase. It works on their mental health also, and it works on their overall health also. Old age, sorry. Old age, if proper attention is paid to, your teeth have a life of 100 years. But if proper attention is not paid to your teeth, then you are going to lose them sooner than you know, right? So no matter what age you are at, make sure you visit the dentist. You at least know what your oral health problems are and then work around it, right? For everybody, it is mandatory to visit the dentist twice a year. I'm not saying this because I'm a dentist. I am saying this because this will help you on a longer go. Yeah. So third dentition, for anybody who does not know, is something that a dentist gives to you. So it could be basically in the form of a dental implant, a denture, or a bridge. Now, what these things are, ये वो जब आपका एक tooth है वो निकल गया या फिर निकालना पड़ा था, या you lost a tooth because of any circumstances, accidental or functional or biologically, we try to make sure that we replace the tooth for you. And no matter what, you will never be comfortable with these from day one, right? There are going to be problems with it. You will be comfortable within a day or so. Having said that, nothing is as valuable as your own precious natural tooth.
So, thank you, Dr. Madhavi ji.
Thank you.
आज आपने हमारे ऑडियंस के एक तो सभी क्वेश्चंस का जवाब दिया, और मैं समझता हूं कि आज का सेशन बहुत ही एनलाइटनिंग था. और हमने सिम्टम्स की बात की, प्रिवेंटिव मेजर्स की बात की, और ऑलमोस्ट हर एज को हमने कवर अप किया कि हमें किस एज में किन बातों का ध्यान रखना चाहिए, चाहे वो बॉर्न बेबी से लेकर एल्डरली एजेस तक हमने कंप्लीट बात की. और मैं समझता हूँ आज का ये सेशन एक बहुत ही अच्छा सेशन रहा, और हमने आपकी जर्नी के बारे में भी सुना, आपने अपनी जर्नी शेयर की, वो भी हमारे लिए बहुत ही मोटिवेशनल थी और एनलाइटनिंग थी. तो मैं समझता हूँ कि आज एक कंप्लीट पैकेज था हमारे ऑडियंस के लिए, ओरल हेल्थ को लेकर और मोटिवेशन को लेकर. तो इसी के साथ ही हम इजाजत लेते हैं डॉक्टर माधवी जी. थैंक यू.
Thank you so much for joining us today. Tell us in the comment section how you liked our today's episode. Leave us comments about your questions, thoughts, and feedback. Do catch us live next week on Thursday at 6 p.m. on YouTube and Facebook channel. For regular updates, stay connected with us and subscribe to our channel. See you next week.